It often starts subtly. A little more hesitation before your stream begins. An extra trip to the bathroom in the middle of the night. You might brush it off at first, attributing it to drinking too much water before bed or just getting older. But then, the symptoms become more persistent, more noticeable, and a question begins to form in your mind, a question that can bring with it a significant amount of worry and uncertainty. Are your urinary symptoms caused by an enlarged prostate? It's the first thing most men think of, and for good reason. We hear about it from friends, family, and doctors as a common part of aging. But the landscape of men's pelvic health is far more complex than a single diagnosis. Could it be something you've never even considered, like pelvic floor tightness? Many men are surprised to learn that the very muscles that support their bladder and control urination can become tense and dysfunctional, creating symptoms that are nearly identical to those of a prostate problem. It's a classic case of a great pretender in the world of urology, often overlooked and misunderstood. Or, and this is the question that often carries the most weight, could it be something more serious? The fear of prostate cancer is a powerful and valid concern for any man experiencing new or worsening urinary issues. The uncertainty can be isolating, making it difficult to know what to do next. The internet offers a dizzying array of possibilities, from benign conditions to life-threatening diseases, and self-diagnosing can quickly lead to a spiral of anxiety. Today, we are going to cut through that confusion. This is your ultimate guide, designed to break down everything men need to know about the prostate, the symptoms it can cause, and the other conditions that can feel exactly the same. Our goal is to empower you with clear, reliable information so you can have more informed conversations with your doctor and take control of your health. We'll explore the distinct signs of benign prostatic hyperplasia, or BPH, dive into the inflammatory world of prostatitis, and demystify the often misdiagnosis of pelvic floor dysfunction. We will also cover other non-prostate causes that can impact urinary function. To truly understand what's happening, we first need to get acquainted with the central player in this story, the prostate itself. The prostate is a small gland, typically about the size and shape of a walnut, located deep within the male pelvis. It sits just below the bladder, which is the muscular sac that stores urine. Behind the prostate lies the rectum. This specific location is key to understanding both its function and the problems that can arise. Its primary biological role is reproductive. It produces a milky fluid that mixes with sperm from the testicles to create semen. This fluid is crucial for sperm nourishment and motility, but its location gives it a secondary and often problematic role in the urinary system. The urethra, the tube that carries urine from the bladder out of the body, passes directly through the center of the prostate gland. This anatomical arrangement is the root of most urinary symptoms. When the prostate is healthy and normal-sized, this relationship is seamless. But when it changes, through inflammation, enlargement, or surrounding muscle tension, everything about urination and pelvic comfort can change. Think of it this way. The prostate wraps around the urethra like a ring, or a donut. Now, imagine that ring starts to swell, as it does in BPH, or becomes inflamed and tender, as in prostatitis. The hole in the middle of the ring gets smaller. Similarly, if the pelvic floor muscles that surround the prostate become chronically tight, they can externally compress this entire zone. In every scenario, the result is the same. The channel for urine narrows. This narrowing, known as obstruction, is what directly causes a slow or weak urinary stream. But the effects don't stop there. Your bladder is a muscle, and when it has to push urine through a narrowed opening, it has to work harder. Over time, this extra work can cause the bladder wall to become thicker, stronger, and more irritable. An irritable bladder is one that feels like it needs to empty more often and with more urgency, even when it isn't very full. That can lead to urgency, the sudden, desperate need to urinate. Frequency, the need to urinate more often than you're used to throughout the day. And nocturia, the medical term for disrupted sleep due to waking up to urinate. These symptoms are part of a larger group known as lower urinary tract symptoms, or LUTS. While they can have many causes, they are most often associated with changes in the prostate. Let's detail the specific symptoms men report most often. First, frequent urination. This is often one of the earliest signs. You may find yourself planning your day around bathroom availability or needing to go much more often than your peers. Next, a slow or weak urinary flow. You might notice that it takes longer to empty your bladder, or that the stream is less forceful than it used to be. Some men describe it as a feeling of low pressure. Post-void dribbling. This is the frustrating leakage of a few drops of urine after you've finished urinating. It happens because the bladder doesn't empty completely, and a small amount of urine remains in the urethra, only to leak out moments later. Trouble starting, also known as hesitancy. You stand at the toilet ready to go, but it takes a few seconds, or even longer, for the stream to actually begin. This is a direct result of the obstruction, a feeling of pressure or heaviness in the pelvis. This sensation can be vague and hard to describe, sometimes feeling like a fullness or a sense that you're sitting on a golf ball. It can be caused by an enlarged or inflamed prostate, or by tight pelvic floor muscles. Burning or pain during urination. Medically termed dysuria, this symptom is often a sign of inflammation, which could be from a urinary tract infection or from prostatitis. Waking up multiple times at night. As we mentioned, this is called nocturia. Waking once per night can be normal, especially for older men, but waking 2, 3, or more times can severely impact your quality of life and energy levels. And finally, pelvic or lower back discomfort. The nerves in the pelvic region are complex and interconnected. Inflammation or tension around the prostate can refer pain to other areas, including the perineum, testicles, penis, and commonly, the lower back. It's crucial to understand that these symptoms can overlap, creating a confusing clinical picture. For example, you might have a weak stream, which points to BPH, but also burning, which suggests prostatitis. Furthermore, they may come and go. Many men find their symptoms fluctuate with factors like stress, diet, and fluid intake. A stressful week at work might cause your pelvic muscles to tighten, worsening your symptoms, while a relaxing vacation might bring relief. This is especially true because pelvic floor tightness can perfectly mimic classic prostate issues. The muscles can clamp down on the urethra and irritate pelvic nerves, causing urgency, frequency, and pain, even when the prostate gland itself is perfectly healthy. This is why a proper evaluation by a healthcare professional is so important. Trying to solve the puzzle on your own can lead you down the wrong path. A doctor can help differentiate between these conditions through a careful history, a physical exam, and sometimes further testing. If any of this sounds familiar, please know that you are not alone. Millions of men experience these symptoms. It is not something to be embarrassed about or to ignore. Understanding the potential causes is the first and most powerful step toward finding a solution, and there are clear, effective steps you can take to find relief and regain your quality of life. In the following chapters, we will explore each of these conditions in detail. The most common cause is BPH, benign prostatic hyperplasia, a natural non-cancerous enlargement. It squeezes the urethra like a kinked hose. As that ring tightens, the flow channel narrows. Starting becomes harder. The stream turns weak. It can become stop-start. Emptying takes longer. You may strain. You may feel like you've still got urine left. You may notice post-void dribbling. Because the bladder has to push harder, it gets irritable. Urgency. Going more often during the day. Waking at night. Key point: BPH is benign enlargement causing narrowed flow. Symptoms can vary day to day. Pattern: obstruction first, bladder irritation second. Up next, when inflammation drives the symptoms, prostatitis. If you want more men's health videos, hit that subscribe button and take control of your prostate health. Prostatitis is different. This is inflammation, not just narrowing. Picture the prostate irritated and swollen. Common symptoms: sharp or burning sensations, lower back pain, pain after sitting, pain during or after urination, pelvic pressure. Sometimes flu-like symptoms. These can flare and fade day to day. If pain dominates but your stream is okay, think inflammation rather than obstruction. Up next, when pelvic floor tightness mimics prostate symptoms, and how to spot the difference. This one surprises most men. Tight pelvic floor muscles can mimic prostate symptoms, even when the prostate is normal. It can cause a stop-and-start flow, a tight feeling in the perineum, a pinching sensation when sitting, difficulty relaxing to pee. Here's the tell. Symptoms often spike with stress, or after long sitting, then ease after a walk, or warmth, or deep breathing. You might feel pelvic pressure without burning urine. Your stream may be hesitant, yet tests come back normal. Think of the pelvic floor like a clenched fist under the bladder. When it won't relax, urine flow stutters. When it softens, flow smooths out. Quick self-check. Try 3 slow belly breaths. Inhale through the nose, then exhale twice as long. Let the belly rise and fall. If your urge eases or your stream starts more easily after, tension may be the culprit. What helps? Diaphragmatic breathing, gentle hip and pelvic stretches, warm baths or heat, avoiding straining, working with a pelvic floor physical therapist or biofeedback specialist. Good news? This is often reversible with relaxation and therapy. Your goal isn't to strengthen, it's to learn to relax, then coordinate. Sometimes the problem isn't the prostate at all. Kidney issues can mimic prostate symptoms. Bladder infections can mimic prostate symptoms. Pelvic nerve irritation can mimic prostate symptoms. Even anxiety can mimic prostate symptoms. Here's a quick map. Kidney signs: flank or back pain, fever, nausea, check. Bladder infection, burning with urination. Urgency, cloudy or smelly urine, check. Pelvic nerve irritation, pins and needles, pelvic or groin burning. Sitting makes it worse, check. Stress and anxiety, symptoms spike with tension. Ease with relaxation, check. What usually doesn't fit: simple prostate enlargement, sudden severe pain, high fever, blood in urine with clots, new weakness or numbness in the legs. X, a calm, step-by-step evaluation. History, urine tests, sometimes imaging, helps pinpoint the cause. If in doubt, talk to a clinician. Proper evaluation helps pinpoint the cause.